It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
And Candace, speaking of some of the best doctors, how about some of the best bariatric surgeons? That's right, we're going to start with My Bariatric Solutions, Dr. Scott Stowers.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she'd lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. Went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just felt really wasn't comfortable with. And luckily at that time, Dr. Williams told me about the Curoscope procedure.
The Curoscope procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was here are the facts, here's what's been done on other patients, and here's the proven success rate.
You know, oftentimes patients come to me, you know, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Chiaroscope procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. You know, there was this weird feeling of intense pressure gone from my back.
After Jesse had the Chiaroscope procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
I travel quite a bit for a living, and noticed in Airplane magazine that Dr. Lewis was advertising for cosmetic dentistry, and never gave it another thought until I tried to get my teeth fixed back where I live. And I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me, so I did some research. I don't know if there's cosmetic dentists up there, I'm sure there are, but I just didn't investigate it, but I did investigate this one and thought, wow, this looks like a good as any, and if he's gonna advertise in an Airplane magazine, he must be pretty good.
So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps in the process because I live so far away. But she's very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, you know, hell, that's funny, you know, something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family and my kids, I actually smile instead of, you know, kind of half smile it. And they were always making fun of me for that. So very happy with the results. The staff is very professional. That, you know, they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, you know, come in and experience it, see for yourself. It really can be very pleasant.
Let's talk about some medical myths. You know, these are things that people think is medically true and isn't. You'd be surprised at what I hear in my office. But for example, my mom always told me that carrots would make my vision better. And that's what we hear nowadays too. We tell our kids that. It's not really true. I mean, vitamin A is very important in your retina of your eye, and vitamin A is really high in carrots, but you get plenty of vitamin A elsewhere. So carrots aren't going to hurt you, but they aren't going to make your vision better. Now, when you pop your knuckles aren't going to get bigger. That's what you hear. You may lose friends and make people cringe because you pop your knuckles, but your knuckles won't get bigger. Drinking milk does not thicken your mucus. I hear people all the time saying, well, if I just cut down on the milk, the mucus that I'm coughing up will be thinner. Not true. Also, fad diets. You know, they say that fad diets are going to make you lose weight. That's not true either, really. They help you, but that's because you're doing all the other good things to help you get healthy. So anyway, there's a lot of things that you hear that aren't true. Ask your doctor if there's any questions, especially if it sounds kind of odd and weird.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Yeah, we tend to think of athletes as being healthy people. They're out running or lifting weights or wrestling or whatever they do. But surprisingly, there are a number of conditions that are more prone to develop in athletes, depending upon what kind of sport they engage in. One of the reasons is they may be in an environment where they're very close to other people that may be carrying a bacterium, for example, like staph, so they're prone to get boils and sometimes cellulitis and folliculitis. So that's one thing that can happen. There's also sometimes herpes virus infections, especially in wrestlers. There's a type of herpes called herpes gladiatorum, which is due to their touching one another in a wrestling match, and one spreads the herpes to another one. Fungal infections too. They get hot, sweaty. The skin, especially in runners or people that are in hot, warm environments, the skin chafes, and then fungus can set up shop there. They can get a yeast infection or can get so-called jock itch, which is due to ringworm type of fungi. So those are all things that we see fairly commonly in athletes. Yeah, athletes can protect themselves if they use careful skin hygiene. So in other words, for wrestlers, for example, they need to make sure that they use a good antibacterial type of wash very frequently, especially after they've wrestled and ideally before they wrestle. So if the wrestlers are all doing this together and they're keeping the gym clean and all this kind of stuff, the chance of spreading those kind of infections is certainly less. As far as trying to prevent things like ringworm, it's good when you're getting hot and sweaty, to let that area kind of cool down. Take a cool shower, let the area air dry so that it doesn't really just stay hot and macerated and whatnot. You think you might have one of these infections, athlete's foot or jock itch or whatever. Probably the first thing you can do is maybe just try something over the counter. There are things like antifungal preparations that you can buy at the pharmacy. If it's not getting better within about a week or so, probably ought to call it to the attention of your dermatologist, have them take a look at it. They can do a scraping or possibly even a skin biopsy. Even though in a young individual that's got the predisposing factors, that's going to be by far the most common cause. There are some other things sometimes that can look like fungal infections that are more serious. So you wouldn't want to let it go too long if it didn't respond pretty quickly to treatment.
For more information on any of the outstanding doctors you see on today's show, as well as request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And now we're going to learn a little bit more about our next best doctor, plastic surgeon, Dr. Robert Wilcox.
One of the misconceptions about plastic surgery is that everybody comes in as a model, wannabe, and so forth, but that's not the case at all. There are all different needs of people who come in through the door.
Last year I had a mammogram and I have had 2 cysts in my right breast for a couple of years and was concerned. My mother had passed away from breast cancer. My family physician, she suggested that I come see Dr. Wilcox. I talked to Dr. Wilcox about a breast reduction, and at the same time when I came for my consultation, I talked to him about a tummy tuck.
She had had significant weight loss, but she recognized she was still heavy. She was very large-breasted as a result of that and wanted breast reduction, as well as recontouring her abdomen. She was considering having a tummy tuck, but her dimensions after we examined her weren't conducive to a safe outcome doing a tummy tuck. So what we were able to offer her instead was simply removal of the lower hanging skin and fat of her abdomen.
It's something that I'd wanted done for several years, but didn't really know if it's something that would be feasible for me. But after talking with him, and he gave me all the information about it and told me how good it would look afterwards, and that's when I decided that I would go ahead with the procedure. I've been very pleased with Dr. Wilcox. His information, his bedside manner, he's very informative. He takes all of the time that you feel like you would want, and any questions that I've had, he's taken the time to draw me pictures and to answer my questions. And his nursing staff and the recovery room, I've never seen anything like it. The nursing staff were so caring, and I never had a fear of anything, of taking infection or anything, because they were so caring and so attentive to my needs.
Listening to the patient, understanding what they think they're going to get, and reassuring them what we can and can't deliver, then we can achieve those goals. Everybody's happy.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that we're removed so that we're sure that we've gotten all of the skin cancer. It has the highest cure rates of any technique of treating skin cancer and enables us to preserve as much normal tissue as possible while still removing all of the skin cancer. The technique is very much like the biopsy in that everything is done in the office. We just use a little local anesthetic, numb the area up, and remove the area that we can see. The way in which it differs from the biopsy is that we take the tissue that we excise and prepare it in our lab. We make our own slides, and I examine the slides under a microscope to determine if we've gotten all of the skin cancer. If we have, we stop there. If we haven't, we know precisely where any residual skin cancer is. We go back just to that area, remove a little bit more tissue, make some more slides, and keep repeating that process until we're sure we've gotten all of the cancer. If the skin cancer is very small and very superficial, the wound that results from the surgery that we do may be very similar to the wound they had after the biopsy. Very often it will heal satisfactorily on its own with good routine wound care. However, if the skin cancer has invaded more deeply or is wider than what it appears to be on initial exam, then we may recommend a repair of some sort. And they range all the way from simple side-to-side closure to a skin flap or a skin graft. And as with all cancer, early detection and treatment is the best way to cure skin cancer.
One of the things that we do here at the Finer Touch is laser treatments for the skin that involve both what we call non-ablative, where no real downtime, you're doing something that's sort of on the surface of the skin and trying to promote a change underneath without actually affecting the surface. And then you can do procedures that are called more ablative. So this is what we generally refer to as resurfacing procedures.
I was seeing a lot of sun damage from years of sun worshiping, dark spots, wrinkles. I went to Dr. Norton for a consultation to see what we could do to take away the dark spots by being the least invasive.
So for those patients who have a lot of texture issues of their face, either from wrinkles, sun damage, acne scarring, to patients who just need a lot of plumping and volume and things like that. This is a treatment that probably is one of the more effective ones for so-called turning back time.
They use a laser to basically burn off the top layer of your skin. It's not uncomfortable at all. They do numb the face prior to starting the procedure.
So an ablative resurfacing technique basically uses the laser to remove layers of the skin and promote a healing response, so that the new skin that comes back is younger looking, healthier, tighter, basically just looks better.
The procedure for itself from the time I got there until the time I left was maybe 30 minutes. And that included the numbing time of the face and then the instructions at the end of the procedure.
Debbie's main concerns were wrinkles around her eyes and mouth. So she had a resurfacing procedure that focused a little bit more aggressively around the eyes and the mouth. And because those are smaller areas, we can actually be quite aggressive in those particular areas.
I would definitely recommend Dr. Norton and the staff at Finer Touch for not only laser resurfacing that I've had done, laser hair removal, and any of the procedures that they offer.
Before I went to Dr. Allen, me and my wife, she was actually the one that was interested in the hormone therapy, and I went with her to the office and was watching the presentation that they had. And a lot of the symptoms they had described fit me pretty good. The fatigue, a little bit of loss of libido, and just not feeling like I was myself anymore.
Male hormone pellet therapy is a kind of a long-term way to give males testosterone. A lot of guys have been diagnosed with testosterone deficiency in the last few years, and there's lots of ways that people try to get their testosterone levels elevated. They try injections, creams or gels that they rub on every night. The pellet therapy is a bioidentical, which means it's exactly the same testosterone that your body makes.
Dr. Allen explained all of the pros and the cons of the therapy and explained, what exactly it was meant to do.
Getting involved with male hormone therapy is kind of an extension of being involved with female hormone therapy. A lot of the females that come in for hormone therapy have brought their spouses in because if it's worked for them, they want to see if it'll work for their spouse.
I feel great. I feel absolutely great. I run around with my dogs. We just moved into a new house, and I've got a lot more energy, a lot more drive. My mental clarity has been great. And another thing was any joint pain or anything like that I had, it's just gone.
We anesthetize the area very well with local anesthetic that we're going to place the pellets in. We make a small incision, and then we place the pellets with a trocar. Typically for a male, you're going to need between 8 to 13 pellets.
I think Dr. Allen makes you feel very comfortable, explains everything in detail and depth. I think the staff at the office is good, and if you have any questions, he goes above and beyond to answer. I would recommend this procedure to anybody who is feeling tired all the time. Don't be too macho to go see an OBGYN to have it done.
You hear a lot about ADD in adults nowadays. A lot of people think they have it, but let me help you understand this a little bit. If you walk into a room and you can't remember why you're there, or you're having trouble getting everything done, that doesn't mean you have ADD. That means you're just kind of a normal human being. ADD is really a pretty pronounced symptom and syndrome in an adult. For example, you may be doing something at home on a scrapbook for the kids and you hear a bus go by outside or a truck go by and you lose your total focus and can't get back into it. That's sort of like ADD. Or you hear a phone ring down the hall at work and you lose your concentration on your computer screen. There are tests for ADD and there's great drugs for ADD. Here's the problem. ADD drugs, they're sort of like a form of speed. They're going to make anybody feel better. They're going to make you think quicker, have more energy, get more done. But if you don't have ADD, all you're doing is taking a drug that's speeding you up, and it's really not good for your heart. So you really need to be tested to be sure you have ADD.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
Carrie is a young lady who complained of breast hypoplasia, which means small breasts. Her breasts were small and she wanted larger breasts. She also had breasts that were not what she thought was normal because she had a tubular breast deformity. What that means is that the nipple was very, very prominent and pointy as opposed to a more natural appearance. So she wanted breast augmentation, larger breasts. She was an A cup and she wanted more of a CD cup. And she also wanted to correct her tubular breast deformity or the prominent nipples that she had.
It was just something I really wanted. I wasn't comfortable with my body at all. I couldn't wear bikinis at all. I couldn't talk in public. So I just thought if I get the surgery, that it would help me out. When I first met Dr. Azouz, I thought he was very friendly and was always smiling, and that would make me smile and feel more comfortable. And he explained everything perfect to me.
Tubular breast deformity is quite common. Many women have a tubular breast deformity where the nipple doesn't sort of lie flat on the breast and is very prominent. In very severe cases, the breast looks like a tube with a pointy nipple on the end. So the object is to make it rounder, to give them cleavage so they don't have these pointy breasts. In Carrie's case, what we did is a correction of her tubular breast deformity, and we also gave her increased volume.
At first I was an A cup and now I'm a 36D, and I just love that. I was surprised I couldn't stop staring at myself in the mirror, looking at the new me. And I would just stay in my room and just keep looking at myself, and I would turn sideways and all that. I love going shopping now. I really do. Because you can wear whatever you want without worrying about if the cut's too low, how you're gonna look in it. I love wearing different stuff now. The dresses, the bikinis, everything. I just love it.
That'll wrap up another edition of the Best Docs Network. Features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news, Candace, for more information about any of the outstanding doctors, you can head to the website, bestdocsnetwork.com. You can even request an appointment.
You sure can. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
And the Best Docs Network magazine is out.
Coming out.
Check your local newsstands. So long, everyone. We will see you next week.